The minute and 3/4.
Thank you, Mr. Speaker. I want to make sure the people of America understand what we're doing here in about 1 hour. We heard during the course of a presidential campaign the promise that everything was going to be covered and we'd be tired of winning. If winning means that 24 million Americans are going to lose their health care coverage, if winning means that imposing an age tax on seniors, if winning means higher out-of-pocket costs for working Americans, and if winning means robbing $75 billion from the Medicare Trust Fund, we don't want to be part of that victory lap. This isn't about one person making up alternative facts. Our statements today have been based upon the CBO, the National Rural Health Association, the American Medical Association, the American Association of Retired Persons, and the March of Dimes. Fewer covered, weaker protections, higher costs. Let's call this what it is today. It is a $1 trillion tax cut for the richest amongst us. They are now facing the art of the ordeal. They have a bad plan and they know it, and they've scrambled for the last week to try to figure out how to stitch it together, and it hasn't worked. So for those across this country, think of the following: no maternity care, fewer hospital visits, no mental health services for those families that are struggling with a family member who has opiate addiction, which is the crisis of our time. This is more of the same: tax cuts for the wealthiest amongst us and health care cuts for everyone else. And I yield back the balance of my time.
When Neal's back.